Do you all know some of the symptoms of a brain tumor? When we hear brain tumor, it just makes you feel really scared. But remember that there are a lot of brain tumors that are benign, and many of them are operable. Not everyone is a glioblastoma, for example, and we immediately think of the worst. We go right to the worst thing and the worst kind. So I wanted to talk about some of the symptoms, and I'll start with telling you in pediatrics what we saw mostly. So in peds and adult medicine, when I worked on the peds floor all those years, we saw a lot of kids with brain tumors, and some of them were malignant and were cancer, and some were benign. The main symptoms that we saw were parents that would come in saying, my child complains of a headache, mostly in the morning, but not always. Another symptom with children is projectile vomiting. That means that instead of just vomiting, it projects out. It's explosive. Projectile vomiting, unsteady gait, tripping and falling a lot, can't seem to walk or ride the bike or even crawl, even little ones. They just are having some gait issues and motor skill issues. Adults can have these symptoms as well, and adults can express it better. So, for example, if there's something going on with memory or with recognition of an object, difficulty speaking, difficulty with speech in general that you can compare to, adults generally can express that. Of course, children can't always, especially if they're little ones who aren't very verbal, and not always is a child going to talk about how they don't have object recognition anymore like they used to. What are some other things you see in an adult? Depending on what kind of tumor and where it's located in the brain. Remember, the skull is hard, the brain is soft. So if there's a tumor inside there and it's going to grow, even if it's small, it could be in a location that's going to affect speech, hearing, inability to walk or have an unsteady gait, going to have some vomiting going on. There's always the typical headache, seizures. Children and adults often present with seizures, just out of the blue, having a seizure. And numbness or weakness can also be on just one side. It doesn't necessarily have to be overall and both legs or the whole body. Usually, to diagnose this, the physician would order an MRI of the brain, would order a PET scan possibly, do labs, of course do a complete history and physical, and then go from there. Possibly you will be with a neurologist or a neurosurgeon. At that point then, they might want to do a biopsy, just like any other part of the body. If there's a suspected tumor that needs to be biopsied just to see what is it so that we can go forward with a treatment plan, then they would schedule a biopsy and that would be done next. With the neurological exam, besides maybe ordering an MRI, PET scan, or biopsy, that provider would do a complete neuro exam. You know how they check your reflexes, your pupils, you know, how strong are you, equal, not equal on both sides of the body, checking all the cranial nerves. That is something that they're going to do in depth. The individual who ends up with a diagnosis of a brain tumor would then, like I said, be seeing a neurologist, would be seeing a neurosurgeon, and a discussion of surgery would take place. What else might take place is if it's found after the biopsy to be malignant, perhaps a discussion about chemotherapy, radiation, targeted therapy, PT/OT, speech therapy, and of course surgery would be discussed in the treatment plan. The brain or spinal cord tumor could be the primary issue, meaning this is where it originated from. Or it could be a secondary tumor or metastasis, which has come from another part of the body. The primary area would be, say, melanoma or breast cancer, and it has metastasized to the brain. Whether it's the primary issue or the secondary metastasis issue, adding on an oncologist, or maybe you've already, or the person has already been seeing an oncologist for the primary cancer, so they're aware to watch for a metastasis that might occur to the brain. So the treatment of seeing a neurosurgeon for either one would still be the same. They're still going to do a complete history physical and talk about treatment options once surgery has or has not decided to take place. The neuro exam is going to take place again, and the cranial nerves are going to be checked again, and a biopsy is also going to be discussed. Because sometimes you can have a cancer in your body that you think has metastasized to the brain, but in fact, this other issue going on in your body, when something shows up in the brain, isn't always a metastasis. It could be a different primary cancer source. So all the specialists come together, come up with a treatment plan. You are included in all of that. And like I say in all my other videos, you are the person, you are the center of all of this. Please come in with questions, speak up. Your questions are important. It's a very scary subject, but neurosurgeons have gone to school a very long time and are very good at their job. I'm trying to give you some reassurance that among the fear, you're going to be okay. Make sure that you get checked out as soon as you feel some symptoms like the ones that I've discussed, because it could be something completely unrelated, because a lot of those symptoms can mean other things too. But in case you didn't know that unsteady gait and projectile vomiting and hearing issues with a headache in the morning, maybe you didn't know that that is an indication of possibly something that needs to be checked out immediately. If you like topics about medicine, myths and facts about medicine, medical errors, and how we can possibly ever get some corrections in place, how we can mitigate issues that might come up for a person going into surgery, coming out of surgery, anything related to medicine, and some fun vlogs too, please consider subscribing. And don't forget to give it a thumbs up, because unless people interact, we all ask for this, then YouTube doesn't see it as anything that they should push out for others to see. It's free. Just give it a thumbs up. Thank you, and I'll see you in the next video.